Today we're talking about a hospital go bag. Stay with us. Hello everybody, welcome to the channel. This is your first time here. We prepare you for the small and big disasters in your life. Any preparedness situation you can think of, we can help you get ready for it. We would love to have you like and subscribe. Down below, if you have comments, we'll try to get to everybody that we can. And please read everything in the full description. Once again, I'm Justin, and welcome to the channel. Today we're talking about our hospital go bag. So this is something that we discussed early in the pandemic in March. This is not just a pandemic related preparedness item. This is something that is good to have, especially if you have elderly family that is more at risk of being hospitalized. Just having some simple things together to make their stay at the hospital a little bit more comfortable. That is complicated now by the fact that most hospitals have limited visitation by family. Sometimes that has to be by doctor's orders. So if your loved one is awake, alert, and oriented, you may not be allowed in the hospital. You may have to communicate with the medical care team by phone. Most of the time they're allowing one person for labor and delivery, a support person, or perhaps the father and one more support person. If you are unconscious or have an altered mental status, a lot of times they will let a family member come into the hospital. But once again, it's different depending on which hospital system you're looking into, and sometimes it requires a physician order. Additionally, most ambulance services or emergency medical services ambulances have a policy currently that nobody rides to the hospital with the patient except under very limited circumstances. So the chance that your loved one may have to go to the hospital alone and be admitted to the hospital alone is all the more reason to put this type of bag together. Now, obviously, if you've got some extenuating circumstances, like perhaps you're pregnant, the things that you put in your bag are going to be a little bit different, and perhaps that's another video that we'll do. But for now, this is just a general hospital go bag that specifically is probably going to help out an elderly person or someone maybe more susceptible to hospitalization or catching COVID-19 and being hospitalized for that. So generally the elderly population, anybody that's over 65. So in no particular order, let's just go through these items. Pajamas, a comfortable pair of pajamas. Now, a lot of hospitals are going to require their patients to wear scrubs, but you don't have to wear scrubs all the time, especially if you're able to get up and walk around. Scrubs are convenient for hospital workers because it allows us access to IVs and equipment and bandaging and wound care and those type of things. But a comfortable pair of pajamas that your loved one can or yourself can be comfortable in is very important to have with you. So you want to have these things in a bag, packed and ready to go, or a list of things that you need to put in a bag before your loved one goes to the hospital. We'll talk about that in a little bit. Let's get back to the actual equipment. So a change of clothes. So you don't know what you're going to be wearing when you're admitted to the hospital. You don't know what circumstance in the real world you're going to be in. If you're going to be at home in your pajamas, if you're going to be butt naked in the bathroom, if you're going to be at work. So having a change of clothes, something to wear home when you get out of the hospital, hopefully, that you can not be embarrassed to wear out in public. So now, these next few things are some of the most important things, especially during the pandemic because of limited visitation at hospitals, is a cell phone. And a newer cell phone. So I know some people still have the flip phones. Those aren't great with the social media apps and internet and those things. So if you really want to be able to communicate with somebody and be able to see them, then a cell phone, a newer cell phone, an Android or an iPhone cell phone is going to be very helpful and very beneficial as far as keeping you in touch with your family members that are in the hospital and them keeping you in touch with their family. Chargers. Chargers can get lost if you are moved from room to room at the hospital, which often happens depending on the hospital's needs or your condition as you're hospitalized. So the charger may be left in the wall, and it may be a day and a half later before you realize you need your charger, and then it's gone. So an extra charger would be wise to have, because if your cell phone goes dead, you've lost all communication except for the phone in your room. A stand or a tripod for your phone. So these things are really, really inexpensive. You can get these things at Walmart. You can get them very inexpensive off of Amazon. In fact, we'll link a few that we have. That's what we use to film these videos. Something that you can set on that little tray, your little food tray that they bring over the hospital bed, and put your cell phone in it and set it down and just be able to enjoy conversation or video or whatever, but something to where they don't physically have to hold a cell phone. Also, they may not be able to physically hold a cell phone, so having a way to record video and audio without that person actually being able to move and ambulate is something that you may want to consider doing. And like I said, they are very inexpensive. Messaging and video apps for your phone. So most of us younger folks, and I'm fixing to be 41, so I'm not calling anybody old, but everybody's in a different spot when it comes to technology. So there are several apps out there that are available for messaging, as well as for video calls and conferencing. So what you need to do is you need to figure out as a family who's at highest risk for possibly being hospitalized for a general medical reason, a broken hip, or coronavirus. That's the person that you need to concentrate on being sure they have these equipment. Not just having the equipment and not just having the bag ready and not just having the apps on the phone, but actually knowing how to use the apps, knowing how to use Facebook and Facebook Video Live and all of the other platforms, messaging video. There's so many out there, but everybody has to be on the same page as far as how are you going to communicate should one of you be hospitalized and isolated, perhaps due to COVID and the visitation policies. So you may have to take the information to these folks. You may have to physically put the application on their cell phone. So be sure that everybody is on the same page as far as which app you're using, and that everybody in the family knows how to use that app, including perhaps the elderly person that is not familiar with that app. And if we don't go over it with them, they may not know how to use it in the hospital, and all that planning you did was for naught. So let's train our family members on what we're going to use. Everybody's on the same page. That's one of the most important things, so they are able to continue to communicate and feel loved. So consider possibly a higher data plan if someone is hospitalized. Another great idea is that if you have elderly parents who are more at risk for being hospitalized for whatever reason, that you have made some planning within your finances and their finances. So perhaps you need to be put down as an account holder on their cell phone bill, or perhaps you already pay their cell phone bill, so it's not an issue. But if they're paying their own cell phone bill and they get in the hospital and don't have enough data and don't have access to good Wi-Fi, then they may go over data and be charged a lot, or you may not be able to get the data and the apps not work. So if you can add yourself as a user on that person's account to where you're able to make changes should you need to, that's probably something to think about. A list of medications. Now, this is something that is good to have all the time. So there are some things that if an ambulance comes to your house, okay, there are some things that they're going to want from family or the patient, depending on the level of consciousness of the patient. We want to know what medicines you're taking. We want to know if you have any allergies. And we want to know what your past medical history is. We also want to know is if you are older or have some kind of chronic or acute disease, if you have a do not resuscitate order or a DNR order, which means if your heart stopped beating, what would you like medical professionals to do to save you? Sometimes that's a person's final wish, and as long as that paperwork is present, healthcare providers will honor that. The paperwork has to be present, though. You can't just say they had a DNR. We have to physically have the paperwork within an ambulance service or within a medical facility in order to not decide to continue resuscitation efforts on somebody's. A list of medications, a list of current medications, not just bottles, with medicines in them. We need a list that is the most convenient for us that we can physically take to the hospital. They want to know allergies, not necessarily food allergies, but medication allergies. We want to know what kind of medical history that person has: heart attack, stroke, seizures, stomach problems, diabetes, cancer, those type of things. If all of that is on paper, even if there's not somebody else, a family member that can give us a history, that gives us enough to go on to get them good continuative care. So insurance cards, or have that insurance information wrote down. Billing is a part of medical care. We have to bill for ambulances. We have to bill for ER stays. We have to bill for the hospital. Having your insurance is something that is important. So have those cards, or have those numbers in the insurance company wrote down. Photos of family members. Now, I'm not saying bring an entire laminated photo album, but a cherished picture of your loved ones, your family, something that is special, needs to be in that go bag, because it may be in weeks or a month or more before somebody gets out of the hospital, depending on the situation. And they may have very, very limited or no visitation due to coronavirus. Let's give them something that they can hold on to and look at and remember their family. Power of attorney paperwork. Power of attorney is when someone basically becomes to where they can't make their own medical decisions. There is another person in the family that has already been appointed by that person to make medical decisions for that person should they become incapacitated. So power of attorney paperwork, medications, allergies, past medical history, insurance ID cards and numbers are very important. If you wear a CPAP to sleep, that may not be something that the hospital will typically provide. Some may be able to, some may not, but a lack of sleep or a lack of quality sleep can deeply affect how you heal and how you get better. So if you have a CPAP, that is something that needs to be grabbed when you go to the hospital, because a family member may not be able to bring it into the hospital later. Just something to think about. Snacks are something that's important. The hospital is going to provide for your very basic needs. They are going to keep you clean. They are going to keep you fed. So all of those toiletry items, the hospitals are going to be able to provide you, so you don't have to clutter your bag up with that. Now, if you have favorite products, you can bring those, but perfumes and lotions that smell a great deal are typically not very welcome in hospitals due to just allergies and people that have breathing issues. So leave those at home. Something else is eyeglasses. If you've got an extra pair, that's just an extra pair, go ahead and put that in the go bag. If you have a tablet, you can bring that. I would say stay away from bringing laptops and things like that. What you want to do is have something that is a backpack size hospital go bag, or even a beach bag kind of sized go bag. You don't need 3 suitcases of things to carry to the hospital. One, it's hard to transport. We don't really have room for it in ambulances. There's not a whole lot of room inside emergency department patient rooms. So the hospital is going to provide for your very basic needs. They're going to keep you clothed, fed, warm. They're going to have blankets, pillows, any medication that you take, they are going to have. They have pharmacies in all the hospitals, so you don't even have to worry about bringing all your medicines from home, because they're going to work with your primary care physician. They're going to work with your pharmacy to be sure that you are getting the medications that you already take daily for your medical problems. So it is best to have this bag packed and ready to go. Everybody in the household, including the person who it may be their bag, they need to be aware that bag is in the house. They need to know where that bag is. Is that bag by the front door? Is that bag in the bedroom with them? Think about if you're not home with that person and an ambulance has to respond. We're not going to know where the bag's at. We're not going to know that you have a bag. So that person's going to have to be able to tell us, hey, I need to grab my hospital bag. A little bit of pre-planning and just putting some things aside and remembering that it's there and a little bit of familiarization can greatly improve your morale while you're in the hospital. Being able to effectively communicate with family and often, being able to sleep comfortably, being able to have some things that remind you of your family and the people and the things that you love. So it's a very simple thing to do. It's not preparing for an apocalypse. It's just, what are the chances that you may end up in the hospital because of an illness or an injury, and what can make that just a little more comfortable and a little easier, which hopefully helps you heal faster. The other thing that I want to say is we rely on cell phones for our communication and calling people. Most of us don't memorize phone numbers like we used to. I still have my phone number memorized from when I was a child and we had a rotary telephone in the kitchen. But nowadays we pick up a phone and we hit the person's name and it dials that person, and we don't give it a second thought. But if a phone battery dies at the hospital, you don't have access to that phone number. Now, there are phones at the hospital. Some patient rooms have them. Most ER rooms don't. But if your loved one's cell phone died, would they know how to contact you if you aren't already listed as a next of kin contact on the hospital paperwork? So, just like all of the other disaster bags that we recommend and plan for, you want to have a list of the important phone numbers for family members and emergency contacts, name, relationship, and a full phone number, just to make things easier should a cell phone battery die, because we really rely on those things. So if you already have a hospital go bag packed, I want to hear what is in your bag. If you have suggestions for what we should add to this list, let us know. We're going to put all of these suggestions down in the comments. If you haven't already, it would really help us if you enjoyed this video and enjoyed the content, that you would hit the like button, and that you would also subscribe to our channel, and that you would hit the bell for immediate notifications at any time that we upload a video. At SafePrep, we help you prepare for the little disasters and the big ones. We're here to help prepare your family for whatever's to come next. God bless you. Stay safe. I'm Justin, and this is SafePrep.